Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about B vitamins, in particular vitamin B6. So let's go into this. Vitamin B6, the forgotten B vitamin, right? Oftentimes people are, talking about, oh, I'm taking B12 or I'm taking folate, right? But B6 vitamin is a prevalent deficient nutrient in the US population. Why? Because things like birth control pills, hormone replacement, antibiotics, and diuretics can deplete B6, right? Also, highly refined diets, carbohydrates and so forth, can also deplete B6. So one of the functional reasons that you can have B6 deficiencies because of these types of things. Now, how many million Americans are on birth control pills, hormone replacements, antibiotics, and diuretics? Diuretics for excessive swelling or sometimes for hypertension, right? There are millions and millions of people on this. And it can cause a functional deficiency, not like an overt deficiency where you might have seizures and so forth, but functional deficiencies. So what is B6 used for, right? It's a cofactor, coenzyme for metabolism of amino acids, and then neurotransmitters, right? Your happy hormones, serotonin, dopamine, your inhibitor hormones like GABA, right? And also it helps to convert ALA to EPA-DHA. Basically, you take certain types of oils and you can convert it and make it usable in the EPA or DHA form, or the omega-3 fatty acid family, right? So when you think about omega-3s, we talk about fish oil or maybe krill oil. So you can take certain types of oils and you can convert it into the usable or good fish oil or good oils, the omega-3s. So you need B6 as a cofactor or coenzyme there. Also, if you don't have enough B6, and B12 and B9, you could increase homocysteine, right? So you need B6 to decrease the homocysteine level. So homocysteine is a marker. It can be actually an independent marker or risk factor for cardiovascular disease, because homocysteine needs to be converted to cysteine. And the way to do that is you need cofactors like B6, B9, and B12. So in order to reduce homocysteine, you'll need B6 as one of the cofactors. Now, what are some of the signs and symptoms of someone who has clinical or subclinical B6 deficiencies, right? So B6 deficiencies, right, in the subclinical phases, you're going to have numbness in the hands and feet, possibly. You can have a trigger finger. It's pretty common where your finger will lock, right? Sometimes that can be an issue with a deficiency in B6. Joint pain or joint stiffness is another factor. Carpal tunnel syndrome is another one where you have numbness and tingling in these three fingers right in here, and possibly half of this finger. So oftentimes people do carpal tunnel release surgery, and oftentimes it's not needed. Sometimes you can take B6 and can help improve the numbness in the hands. Obviously, there's other factors for carpal tunnel like excessive use, typing, injury, and so forth. But certainly you can try B6 for that. Also, depression. People don't realize B6 is utilized to make GABA, serotonin, dopamine, all these neurotransmitters. So B6 deficiencies are related or are linked to depression. Another one is some people can develop light sensitivity, right? The lights, and it causes tearing in the eyes and so forth. Another one is fissured tongue. When you look at someone's tongue, it should be pink and smooth. However, you can get fissures in the tongue, right? Or sometimes people get some numbness in their tongue, and it can be related to the B6 deficiency. So there are a lot of little things. If you have some of these signs and symptoms, you can go ahead and try B6. I'm going to go ahead and talk about some of what types of forms, what kind of lab markers, and so forth we can check for B6 deficiency, okay? So as we continue, we want to know what clinical markers, what lab markers can we look for when we have a B6 deficiency? Not just looking at the blood for B6, but what other markers, right? So one of the markers is homocysteine, like I spoke about. So the number it ranges, is a big range, but ideally you want that number to be close to 7. And if your homocysteine goes above 9, 10, you could have some of those symptoms that I just talked about, right? So you want that number to be below 9, just around that 7 mark. Another marker called AST, often people think about it as a liver enzyme. However, it's also related to heart, liver, kidneys, and brain, right? So without the proper levels of B6, your marker can be below 10 or below 9, right? The range goes up to around 32, 34. However, if the numbers are actually lower than 10, it could be indicative of a B6 deficiency. Another marker is MCV, or mean corpuscular volume, anything over 92. So mean corpuscular volume, or MCV, is a marker for red blood cell. If you do not have enough B vitamins, B9, B12, B6, the red cell becomes large to carry more oxygen. And the higher the number, the worse you are. So if the number goes above 92, or some people will see it at like 102, that means they're severely lacking in certain B vitamins, and B6 being one of them. And this can actually create anemia, a megaloblastic anemia, due to B vitamin absorption issues or genetic defects and so forth. So you have to have that number below, we like to see it below 90, but anything above 92, you better be concerned. The other one is remembering dreams. So if you don't remember your dreams at all, you feel like you don't dream at all, then it's a possibility that you can have a B6 deficiency, right? That's an interesting fact. So when you can do an experiment where you take 100 milligrams for 30 days of B6. The form I recommend is P5P, or pyridoxal 5-phosphate. And the reason is because this does not accumulate in the body or cause damage if you take excessive amounts of B6. So you want the P5P version of this. So if you don't dream, or you feel like you can't remember any of your dreams, what you can do is take up to 100 milligrams for 30 days per day, right? Most people can titrate down and get down to about 50 or even 25 milligrams, but you can take it until you start remembering your dreams. You get up and you get vivid dreams, and you start to remember the dreams that you've had. That can be an indication that you had some deficiencies and you took some B6 in your dreams. You could start remembering the dreams that you had at night, right? Again, the most important thing here is you want to use the pyridoxal 5-phosphate form of B6, not straight up B6. Because if you take a lot of B6, it could actually do a little damage to the nerves. So it's very important to do that, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.